The reason it's so important that we have effective engagement with the public and with patients is that that informs the sort of services that we develop and deliver in Southwark. What that means is that those services will reflect more effectively public and patient expectations and needs. They will then hopefully be able to use those services much more, and that in the end is going to result in much better clinical outcomes for the population. We've chosen to use our patient participation groups in the practices to inform everything that we do as a governing body through a pyramidal structure in which we get representatives from those patient participation groups to sit on our engagement and patient experience group, which is the group that I chair and obviously can then inform all of the strategic developments of the CCG.
I do feel that I'm representing the voice of other people who go along to the patient participation groups at different levels, because first of all we decide at our local practice PPGs what issues we want to take to the locality group, and then from the locality group, where I'm the co-chair, we then decide on two really burning issues that we take to the EPEG. We've got a responsibility to make sure that we get the key messages out and that we look at everybody. There's other people, we talked about diversity, there's other people who may have difficulty with the language in the sense that English might not be their first language, and that can be older people and younger people. So we need to make things simple and easy and the best that we can so that everybody gets the message that they need to receive.
When we first started sitting with EPEG, we used to have a 2-hour meeting 4 times a year. It was actually the members of EPEG that said, no, we are really finding this contribution interesting and helpful and informative, and I now have to chair a 3-hour meeting every 2 months. So you can see that actually patients are genuinely engaged, and I think that's because they see that they're starting to make a difference and they're starting to influence what we're doing. So I think we have now very effectively managed to engage with patients from practices. But actually we know that the patients who tend to come along to patient participation groups are not truly representative of the population of Southwark as a whole. So we've already recognised that the next challenge facing us is how do we get a much broader engagement with the population of Southwark, and we've already started to work on how we can do that. And I think in those situations we're going to have to go out to those groups, and we've already started to do this by going and meeting minority groups, finding out a little bit more about what they think, and we're doing some work at the moment with membership engagement services to try and develop a much broader database of people who we can ask to contribute to specific services that we want to develop.